The Dental Brief is brought to you by Omni Premier Marketing and the amazing guests who bring wisdom and advice that you can put to use to take your business and practices to the next level. Find us on Facebook and join the conversation. Get ready to grow because we are kicking off the next episode in 3, 2, 1.
Hello, everyone. Welcome to another episode of the Dental Brief. I'm so excited to have such a talent in the industry with us, fellow podcaster, to someone who knows what they're doing in the world of dental practices. Brittany Rogers, say hello to everyone.
Well, hello, everyone. I'm super excited to be here.
Yep. So we're going to talk about, I think we're going to talk about CRMs. So we're going to talk about practice management software. Does that sound right?
Practice management software is kind of my thing, so that's what
Yep.
I feel most comfortable talking about. But if you want to talk about like sports or the weather, I'm down too.
Yeah, I'm not down for the weather. We can talk about sports, but I think our listeners definitely want to hear more about what you do. I'm going to ask a couple of questions specifically about what dentists can do to really maximize what they're doing with Open Dental, and maybe even for any practice management software for that matter. But first, tell me, how'd you become an expert? How did you come to where you're at now? What was your evolution through dentistry from where you started to where you're at now?
I love this question because I don't think anybody, when they're 6 years old and you ask them what they want to be when they grow up, says, I want to teach people how to use dental practice management software.
Right.
So I was looking for a change in my life when I was like 20 years old, and I applied for this job that I saw on Indeed that I was incredibly unqualified for. I had 0% chance that I was going to get this job, and somehow I must have just wowed them during the interview, and this dental practice called me back and they offered me a job.
Wow.
So I had previously been working at a gas station in their like kitchen, so not really anything even remotely close to what I was doing in the dental office, but forever grateful that they took a shot on me because I wound up staying with them for 5 years. I was working at the front desk on like my first or second day, and we checked out a patient who had just completed a full mouth restoration case. He had gotten his smile back. He was in tears. We were in tears. And it was at that really moment that I knew that dentistry was going to be it for me in some capacity, because you don't get experiences like that at the gas station. I'll tell you that.
Sure. Right. Yeah. So you are working in a practice, 5 years, front desk, you're answering the telephones. We could have 100 episodes about answering the telephones. But tell me next step. So how did you go from practice all-stars, someone that's, obviously doing a great job inside of a practice, or you wouldn't have moved forward to where you're at now?
So I, very early on in my employment, I wound up finding out that I was pregnant with my second baby and had a very complicated pregnancy. So I was put on bed rest pretty early on in my pregnancy. And again, a million thanks to the practice that I started at, because they were like, you seem okay. We're going to let you work from home, and we're going to let you just learn open dental software inside out and backwards. So when you come back to the office, we can convert to open dental. So I had the unique opportunity for multiple weeks, for 3 to 4 months, to just spend 40 hours a week watching videos, playing in the software, figuring out what makes it tick, and turning really into an open dental whisperer of sorts. And I was able to then take those skills and help the office that I was working for grow. We started at 1 practice and we expanded to 10. So as we purchased new practices, we were switching them over to open dental software. So I got really good at teaching teams who were maybe not super excited about the change to the software to learn to love the software. And that's when I realized that the part of my job that brings me the most joy is watching a team member go from scared of change to, oh my goodness, I love open dental software. This is the best thing. I wish we had done it sooner.
Wow. So I know quite a few practices that use open dental software. I know that you're an expert in that. I think that you probably can help people that are not using open dental too, even if it's just giving them insights into open dental and the pluses and minuses of it. And there's minuses, right? Or there would only be one, right? That's what I tell people all the time. If there was one perfect car, we would only have one car on the road. There's room for competition. But what are some things that you see in practice management software that dentists and their teams are not doing, are not either inputting in, that are not taking advantage of? And this can, so for all of them, what are some mistakes that you see that they're making? A couple of little changes they can make and make a big impact in their practice in one way or the other. What do those look like?
Yeah, for sure. So, first one I think applies to really any practice management software, no matter what you're using or what you're doing. You don't know what you don't know when it
Sure.
comes to your software. So, investing in training of your team, even if it's just one team member that you're going to have them really learn the software, like I was fortunate enough to do. So, you can learn all of the ways that you can optimize the software that you're currently in. It's not always the right time to make a switch to something if you're unhappy with your software. So,
Right.
figuring out what makes your software tick is going to be a huge one, no matter which one you're using. I would say, in addition to figuring out what makes your software tick, I would also look into how it's actually designed to be used. I
Mhm.
have helped so many offices do conversions, and everybody says in the first few days, well, in my old software, XYZ, can we make this software do the same thing? And I have to remind them there's a reason we made this change. If we were super happy with our last software, we would still be using it. So let's look at the ways that this software works and is designed to work instead of turning it into a cheap wish version of the software that you had before, and see how that can help your practice optimize.
Right. And that makes a lot of sense to me. I see this happen often with these types of softwares, anything that can run a business. I'll often say CRM, but they're very similar, right? Where the manufacturer of the CRM, when they started it, usually started it because there was a hole somewhere that needed to be filled, right? And there's like, hey, it doesn't do this, and we need it we need a software that does this, or people will want it. And sure enough, they build it, and they don't necessarily do the best job of training their users how to use it. So they're experts at building it, they're experts at making it run. They're usually pretty good at taking suggestions. A lot of great softwares have a place and a time for you to give suggestions on things that could change and improve, but they just don't train their teams. Is this what you see across the board? I mean, is this why you guys exist?
110%.
Yeah.
Especially with open dental software, there's not really a great training program that they offer. It was created by a dentist who wanted to fix a problem, and then he doesn't want to be a software guy.
Right.
So he's kind of left it into the hands of the users, and so many users have learned exclusively from YouTube. And while that can be great, I learned how to drive a stick shift car from YouTube. I wouldn't be able to do it without it. You don't know what you don't know, and YouTube
Sure.
can only you so many things. So if you're like, oh, well, this is how I post a payment according to YouTube, that may be right, but it may not be the best way for your particular office.
Yep. All right. So here's a big money question. So we always love to give our listeners something they can take away today that will make a significant difference in their practice. I know right now people are saying there's a lot there's a lot of talk. I think a lot of it's just rumors and guessing that, things aren't so great economically, that maybe, things are slowing down. There's not as much cash in the market. I heard somebody say yesterday, I don't know if it's true or not, that care credit's not as improving as much as they are. I don't know. The sky's falling, right? Um, what are some ways that you can take advantage of open dental or whatever practice management software you're using right now to increase either bringing patients back into the practice that haven't been there for a while, or even use it to bring in new patients? What are a couple of things that they can do right now to increase treatment, to increase patient care revenues in the practice?
100%. So I'm going to also add on to that. So, how to get patients back in when we're following up on patients that need to come back into the practice. Open Dental's got automations for recall lists, so we can try and run reactivation campaigns really
Mm,
easily through the software. So we don't let our patients fall through the cracks. There's also treatment finders, which can filter down your patients who have treatment plans that they haven't scheduled based on how much they have left of their annual maximum if you're in network, or by their carrier if you're trying
mm,
to make a push for patients who have better reimbursement this month. You can look through those reports in ways that make a lot of sense. In addition to being able to reactivate patients who maybe have fallen through the cracks, it also has really great tracking metrics. So instead of having to produce more, we can just collect more of what money we are leaving on the table. So it really makes it easy to automate your revenue cycle management. follow up on claims that are outstanding, follow up on patient balances that are outstanding, and keep everything centralized so you can build a sustainable RCM protocol that fits your practice.
Wow. I mean, it's a no-brainer, right? So why aren't more people doing it? Why are not people taking advantage? What is the number one reason that people don't look to dive deep into their practice management software and make it work for them the best way it can?
I think most practices are used to having limitations in their software where it kind of just is what it is. And people who switch to open dental aren't used to having all of the flexibility that they have. They don't understand all the areas that are customizable because they're so used to having a software that's kind of black and white, where open dental is more like rainbow colored. You can choose all the different things that fit your practice. So they just don't know that that's an option yet.
Sure, that makes sense. So, what's the number one reason why that you see? What's one of the biggest excuses why dentists don't invest in training themselves and their team members? What's one of the excuses that they give you, and what's your answer to that excuse?
So a lot of the times, first of all, I've been very lucky that when people reach out to me, they want to learn about their software. But when I do have people who I communicate with that maybe are a little bit more resistant, it's because they don't see the ROI in it.
Hmm.
Um, our whole mission is to help offices work smarter, not harder. And they don't understand that saving 5 to 10 button clicks per patient per day by learning your software actually has a massive ROI because you're not burning out team members as quickly. You're not having to hire new and train new team members all the time because they're just tired. And also, you're able to see more patients when you have a really nice system in place. Maybe it's block scheduling and we're doing that really efficiently. So they don't see the ROI in things. And my answer to that is, well, let's look at some ways that let's look at 5 things we can do right now that can I can show you ROI will have.
Sure, that makes sense. Give us one of those things.
Well, I said block scheduling. That's been my favorite one right now. OpenNL's got some really great tools to set up block scheduling where you can run reports to see what times of day are your new patients trying to schedule most. What times of day are you having the lulls in your schedule where we can put things like that's where we put our crown seats where we're not getting the we're not getting the patients who want to come in, so we can do our deliveries during those times. In addition to that, I'd say a lot of the automated features, like if you have a appointment cancel in the middle of your hygiene column, you can send a mass text to all of your patients who are on your ASAP list to try and fill that hole in your schedule so you have less downtime.
Awesome. So your website is skfpracticesolutions.com. I want to encourage our audience to go there. I know that you've worked with 400 or 500 practices, that you've made some pretty big changes and impact. Congratulations to you for that. It's certainly making a big difference in the dental world. What does engaging with you look like? If somebody wants to find more information or kind of check you out and see what you're all about, what your company's all about, what's the best way for them to do that?
We are very active on all the social medias. Core of my team is millennials, so we hang out on Facebook and Instagram pretty regularly. We even dabble in TikTok a little bit. So if you want to just learn more about us, we're giving away all our best stuff for free on social media platforms. At the end of the day, our entire goal is to help you work smarter, not harder. So we're happy to do that and give you the resources so you can build those protocols yourself. So social media is the best place to find us. We're SKF Practice Solutions on all the platforms.
Awesome. Brittany, thanks so much for being here. I appreciate your time.
Yeah, thanks so much for having me.